afternoon. Welcome to today's Wisconsin Health News virtual event on the impact of climate change on health. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thanks to all of you for tuning in. We have a great panel with us today to talk about a very important topic. I am thrilled to introduce Monica Nakielski, Director of Sustainability for Advocate Aurora Health, Dr. Andrew Lewandowski, Education Co-Chair for the Wisconsin Health Professionals for Climate Change, Representative Supreme Moore Omokunde, and Lieutenant Governor Mandela Barnes. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. This is a new series for us. While we are very hopeful to get back to in-person events in the near future, we have learned over the past 2 years that these virtual events do hold a lot of value. For one, it allows a lot more people to tune in from across the state. So it is something we do plan to do all year in addition to our in-person event series. So a huge thank you to the sponsors of our debut Wisconsin Health News virtual series, Advocate Aurora Health, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gunderson Health System, Hush Blackwell, and WPS Health Insurance. Thank you also to Badger Bay Management for helping host today's event in partnership with Wisconsin Health News. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial. You can sign up on our website at wisconsinhealthnews.com or through the event evaluation, which we'll email out after today's event. An extra thanks today to Hush Blackwell, today's featured sponsor. We are very grateful for all of their very generous support. And here to say a few words is Hush Blackwell's Tom O'Day.
Great, thanks, Tim. All of us at Hush Blackwell are very proud to be a partner of Wisconsin Health News, and those of us individual attorneys, Tom Shorter at Hush Blackwell, Bruce Arnold at Hush Blackwell, myself, Tom O'Day, Jed Rower, Wendy Ahrens, and many others, we're proud to be part of the Wisconsin Health News for some years and even at its inaugural debut. So Tim, thank you for the work that you do. It certainly is a service to the state of Wisconsin, and for that, we're appreciative. We're excited today to present a number of different public policy discussions over the years, but today the public policy discussion that is so important. And at Hush Blackwell, we pride ourselves on having a real world application of the law. And we're here today in what you do every day as healthcare professionals and leaders is that real world application of public policy and the law that the representative and Lieutenant Governor Barnes are so integral in making. So thank you all very much for your service in whatever role that is in the healthcare industry. Again, with our partner Hush Blackwell Strategies on the government relations side, here at Hush Blackwell, we take pride in serving the state of Wisconsin, and we're proud to be part of this sponsorship of the Wisconsin Health News. So thanks again for joining. Enjoy the discussion. And with that, I'll turn it back over to Tim.
Thank you, Tom. Thanks again to Hush Blackwell for all of your generous support. So we have focused so many of our events over the past 2 years on COVID-19, and there will of course be more to come. We thought it would be good to take a break today and focus on another global crisis with major health consequences, climate change. So more and more the signs of climate change are all around us. Higher temperatures, raging forest fires, increasing floods. What's less visible but becoming more recognized is the impact this is having on our overall health. Late last year, the World Health Organization declared climate change the single biggest health threat facing humanity. Just as there's growing recognition of the impact that housing and food insecurity has on someone's overall health, also significant is the impact of rising temperatures and clean water and clean air. And just like the COVID-19 pandemic, the brunt of this is not being felt equally. It's our most vulnerable communities, those with the least resources, that are feeling the most impact. Meanwhile, the US health sector does more to contribute to climate change than any other health sector in the world. By some estimates, the health sector produces up to 10% of greenhouse gas emissions in our country. That's leading more and more health systems, including the one we'll talk with today, to take a lead role in environmental sustainability efforts. So we have lots to talk about. So I'm going to dive right into the question. And Lieutenant Governor, let's start with you. You have spent a good part of the past 2 years chairing the governor's task force on climate change. Can you briefly share with us some of the things that you've learned in terms of the impact that climate change is having in health?
Well, absolutely. And, we've always known that there is a public health component to climate change. And Unfortunately, the response has been the same as it's been for the pandemic. There are so many parallels there. Now, there's also the case where some of the contributing factors to climate change are also the contributing factors to poor health in communities. It's not the personal decisions as they try to make it seem too often. We have lower income communities that are located closer to coal burning power plants, as an example. When we even see the proposal for nuclear energy, like it's always in very specific communities. It's not, these things are never proposed in more affluent communities. So there is certainly a disproportionate impact that too often falls along economic and or racial lines. But we also see where the solutions to address climate change aren't always equitable either. And that's one thing we want to do with the task force. We led with environmental justice in mind, and we want to be very deliberate about talking about those very specific instances and the very specific outcomes that communities continue to grapple with as a result of climate change. This could be also, heightened lead levels. While this is not a climate change issue, it is an environmental justice issue, and it's something that has to be considered. And there's also the availability of resources in these same communities for people to be able to educate themselves. So throughout the work of the task force, these aren't necessarily the things that we learned, but they were the things that we were intentional about addressing.
So thank you, Lieutenant Governor. So looking at, and I'm going to stick with you for this next one, looking specifically at the state of Wisconsin, what are some of the biggest climate change risks? And you mentioned, an environmental risk with lead pipes. Looking at Wisconsin, we're not too likely to have a major hurricane or earthquake here, at least anytime soon. What would you say are some of the biggest climate change risks facing us here in Wisconsin?
I mean, there was a hurricane in Iowa a couple of years ago with the derecho, so I wouldn't be so fast to say there's no potential for a hurricane here. But I will say there's the threat to our water quality and also the threat to our food system. Wisconsin is an ag state, and the fact that we have either these historic, never-ending rainy seasons or historic droughts, it's almost like one or the other. It creates a lot of uncertainty with our growers, with our farmers, with our producers. And if this is the case, if our food systems are compromised and we're also, talking about, monocultures instead of, diversifying our crops, and soil health is another thing. Soil is eroding at such an alarming rate, And if we don't have healthy soil here in Wisconsin, then that's the industry. And not only is that the industry, not only is there an economic gut punch, there is a livability factor that we'll have to consider in this region. And, the Midwest is prime for an influx of people due to, climate migration. People from the coast who are experiencing these historic flooding events or rising temperatures that will make those areas uninhabitable. If the Midwest is going to be a place that could potentially, house or the bulk of the United States population, and we have poor soil quality, we're not able to feed people, then that'll push this already existing catastrophe into hyperdrive. So I would say the impacts on our food system and our water quality, the Great Lakes, the rate that they're warming up, threatening perch populations, our trout streams, if their spawning locations are threatened because of a rise in temperatures. Not only does that threaten the fisheries and in subsistence, it also threatens our tourism economy. People travel all across. I forget the number of out-of-state fishing licenses that Wisconsin hands out. We may be third in the country, if I'm not mistaken. So we're talking about just an all-around impact that people don't always consider. But I would say, again, the food systems, water quality, that's where our attention should be focused.
Thank you. Dr. Lewandowski, when you are not working to save the planet through your work with the healthcare professionals for climate change, you are a pediatrician for Group Health Cooperative of South Central Wisconsin. Looks like you're calling in from the clinic today. What are some of the climate change impacts that you are seeing directly with your patients?
Yeah, sure. Thank you for having me today. And you are absolutely right. This is not a fancy Zoom backdrop, but this is what things would look like if you were joining me for an ear check. So, but before I address that question, I just wanted to say a couple of things. One is that I'm really excited that this webinar is in a panel format today. Because panels are all about discussions, and I'm hoping that anyone who's joining us today, whether you're an individual, whether you're representing a health system, I hope that people recognize that all of the individuals on this call today would like to continue that discussion. Reach out to your legislators, reach out to Lieutenant Governor Barnes's office or Governor Evers' office. Speak with your healthcare system, speak with your doctors, speak with your employees, and speak with us. If you have questions, concerns, or you're looking for how to do more, let us know, because it's a tight-knit community that's dedicated to climate justice solutions, and we want to make sure that this is something that's fixed. And the other thing before I address climate change and health effects, as I do want to call attention to the Intergovernmental Panel on Climate Change and their assessment report, their sixth version. It's called AR6, Assessment Report 6, that came out last year, 2021. And for those who don't know what the IPCC is, it is kind of the organizational body from the United Nations that looks at climate change and its influences. And it requires kind of consensus and approvals from the 195 participating governments. And just before we get talking about the effects, I just want to tell you, I'm going to read verbatim from the current state of the climate. On their, essentially the first page right after the introduction, it says, "It is unequivocal that human influence has warmed the atmosphere, ocean, and land. Widespread and rapid changes in the atmosphere, ocean, cryosphere, and biosphere have occurred." And so just for anyone who is still on the fence, getting 195 countries and a UN body to say that this is caused by human influence and that it is unequivocal is huge. I mean, this kind of puts it, if you're willing to deny climate change, we're now kind of in the same people as the people who deny that the earth is round or that gravity doesn't exist. So climate change is here. And that's why I'm a climate medicine physician in many ways, is because I'm now able to study the effects of climate change on human health. So I just wanted to make sure that was clear for anyone. If people are interested in talking to me more about that, I'm happy to address that after the panel or during the panel if there's an open section. Now, as far as in my clinic and in the region, I definitely agree with what Lieutenant Governor Barnes was saying. I would say the 5 impacts that you're most likely to see as a practitioner in the Midwest are going to be extreme temperatures. Even though climate change is a warming trend, we actually see weather volatility. So weather is kind of what happens on a day-to-day basis. Climate is sort of the reputation of an area. You live in a humid climate, or you live in an Arctic climate, or you live in, a tropical climate. And so weather volatility is huge. So extreme temperatures are going to be big, with extreme cold and extreme heat. Extreme weather events like flooding are going to be a big deal for the state of Wisconsin and the Midwest. And to that end, I agree, we are going to see food-related and agricultural events, food-related infection, water-related infection. We also see mosquito and tick-borne infections in the state of Wisconsin, and we know that those are projected to increase as the tick and mosquito habitat is increasing. And so things that are already a struggle for us as I treat patients in my clinic who have things like ehrlichiosis, Lyme disease, babesiosis, all these other osises that are requiring us to treat patients. And I also want people to realize that when we look at the effects of climate change on health, it's important for us to consider the direct effects of climate change and the indirect effects on climate change. There are about 8 different ways climate change affects humans. There's a great CDC graphic. You can go to the Center for Disease Control's website and just go to their climate change section, and they have this wonderful kind of a circular graphic that spells things out. And if I just picked one of those, let's just say extreme heat, we know there are direct effects of extreme heat. The patients who are coming to me looking for sports clearance, because they're going to be doing 2-a-day practices on the field for their soccer practices or for football practices. I know that extreme heat is going to affect them directly. Or for people with chronic medical conditions who are more susceptible to dehydration, people with kidney disease, people with lung disease, heart disease, these people who are more directly likely to have issues from extreme heat. But then there are also indirect effects. So when we think about heat, we know one direct effect of heat is increases in irritability and aggression, depression, suicidal ideation. And so then when I consider the indirect effects of those, all of a sudden I'm wondering about, well, how does this relate to enhancing the opioid epidemic that our state's facing? How does extreme heat affect domestic violence in the state of Wisconsin? Child abuse? How do these indirect effects kind of relate to the milieu in which we live? You can see the same thing with flooding. We know in 2018 there was a flood in the Madison area, and there were direct effects. There was unfortunately a man who died on the west side of Madison. But we also know that there are going to be places that experience worsening issues with mold following flooding effects. So how many emergency departments are going to be seeing asthma exacerbations as a result of worsening of mold-related illnesses and respiratory illnesses? And then I think it's also important for us to consider the effects that climate change has on healthcare provision. That same flood that I was referring to in 2018 that killed that man on the west side of Madison, we also know actually knocked out one of Group Health Cooperative's clinics on the west side of Madison. So what's necessary for your community to run? You have healthcare clinics that are necessary to provide medical care and to help patients. We have grocery stores, we have banks, we have so many places that could potentially be affected by a flood, for example, and all of those things that make up our society then have effects on human beings. And resources is part of that too. Maybe that's something that Monica will be able to touch on. But so, for example, Hurricane Maria in 2017, we know knocked out a number of plants in Puerto Rico that were responsible for creating saline bags. And so even though this hurricane was not directly affecting the state of Wisconsin, we know that hospital systems around the country potentially were facing shortages of saline bags needed for cancer chemotherapy, needed for anticoagulation, needed for a number of other things. And so even when things happen, half a world away, it doesn't necessarily mean that it isn't impacting us. So I'll maybe pause there and let you move on, but the effects on health are wide reaching and not necessarily just that my asthma and my allergies are worsening, which not to minimize that, but the scope of this is huge.
Thank you. So can you just, as a follow-up, can you just briefly tell us about your group, the Healthcare Professionals for Climate Change? Why was this group formed? What do you guys do? And you've kind of answered this, but why is this something that healthcare professionals are so involved in or should be so involved in?
Sure. So just to clarify, we're the Wisconsin Health Professionals for Climate Action, or WHPCA. It is a mouthful, and so I apologize for that. But
I was close.
Yeah, Wisconsin Health Professionals for Climate Action, and we're a nonpartisan 501c3 that was created a couple years ago. And it's because, like I mentioned, climate change is here and it's currently impacting our patients, and we know that it's projected to worsen over time. In 2019, there was an endorsement, or there was a policy action agenda called the U.S. Call to Action for Climate, Health, and Equity, a policy action agenda. And that policy action agenda had organizational endorsements from over 150 healthcare professionals, 150 healthcare organizations around the country. And these are major medical groups, things like the American Medical Association, American Academy of Family Physicians, American College of Physicians, American Public Health Association. All of the big name groups signed on to this declaration saying that climate change is a health emergency and that we should be urging multidisciplinary action, and that we should be forming coalitions to address this existential threat. And so, and asking, why this organization exists, it's because there's a need for this organization. And frankly, there's a need for way more to occur than this. I mean, we should really be designating full-time employment to all of these activities within healthcare systems, but then within large organizations, within government. Fortunately, Governor Evers, for example, has placed the executive order to establish the Office of Sustainability and Clean Energy under the Department of Administration, and Maria Redmond and her team have been doing a great job of putting together that comprehensive clean energy plan that is based off of a number of the Governor's Task Force on Climate Change recommendations. These are the things that need to happen if the harms that I'm seeing in my clinic are going to be put to rest.
Thank
or
you.
At least prevention.
Excellent. Representative, I want to move on to you. In your previous life as Milwaukee County Board Supervisor, you were part of a city-county task force on climate change and economic equity. Can you talk just a little bit about why this group was formed? And I know you're now moved on to the legislature, but what were some of the main issues that this group was formed to focus on?
Well, thanks for having me, first and foremost. And I want to echo many of the comments made by my colleagues, Lieutenant Governor Mandela Barnes and Dr. Lewandowski. They stole a little bit of my thunder there. However, the reason that we wanted to form the City County Task Force on Climate Change and Economic Equity is because we knew we had dual existential threats. We had climate change and what was happening in our community with climate change, as far as browning outs and dumping in certain areas in our communities, et cetera. And also, if we look at things like polar vortexes, were giving us negative 30-degree temperature days where we were going to be paying even more for energy, and that would take more money away from putting food in the mouths of our residents, et cetera. But we also knew that we had this other threat that after deindustrialization in the city of Milwaukee, we saw hordes of jobs leaving our city. And we saw an opportunity that one could affect the other. That if we addressed climate change and we also created the jobs, the green industry and the green commerce that we needed to actually address climate change, we could also employ hordes of people as well. We could build new green infrastructure and new green industry in the city of Milwaukee. And we could also, it could also get jobs to those who most readily needed it, primarily those in Black and Brown communities. And so we saw both of these things together. So we named it the Task Force for Climate Change and Economic Equity, because we were tackling two things at once, killing two birds with one stone, pardon the pun. And we were able to address both at the same time, using each other to do so.
Great. Monica, I have not forgotten about you. I want to move on to you. Thank you, Representative. Advocate Aurora Health has positioned itself as really as a leader in environmental sustainability. And I do want to, a little bit later in the program, get into all the great things that you guys are doing, including an ambitious goal to rely completely on renewable electricity by 2030. But first, why is a large health system like Advocate Aurora spending all these resources? I mean, why does your position, Director of Environmental Sustainability, now exist in a health system?
Great questions put out there. But before I begin, I'd like to thank you all for inviting us to participate. Thank you for elevating this topic. Thank all the participants who are here, and my fellow panelists, dedicating the time to this important topic and the energy to addressing climate and health, so that we can give those people we care for and generations that follow a true future. I also want to echo Dr. Lewandowski's comment on the partnerships and collaboration. We recognize historically and over time, we can't do this alone. Much of our work across our system is really led by the permissioned commitment support by our senior leaders, the collaboration between our team and division and department leaders, and of course, those relationships that we have with NGOs like PCA, governments, vendors, and manufacturers. So thank you. I'd like to just quickly add, how climate is impacting health and how we view it. So we talked about food watersheds. We talked about food sheds. We talked about watersheds. I'd like to also quickly talk about air basins and the fact that Sheboygan and Milwaukee are within the top 25 most polluted cities in the United States for either ozone or year-round particle pollution. And that is really important for us. Along the topic of air pollution, last year there was a girl in the UK who on her death certificate the cause of death was air pollution. And for people who are following, in November, for the very first time ever, it was published that a Canadian woman was diagnosed with the health outcome of climate change. So her acute and chronic health outcomes were based on climate change. So this is really important for us. Our health system is looking at environmental sustainability as an added strategy for population and public health. You know, it's not going to solve the opioid epidemic. We're not going to even touch upon death with dignity. Some could say it's related to mental health, but at the end of the day, there's a shared commitment across our organization that with a healthier environment and, you know, having influence over our activities is going to lead to healthier populations. I'm new to this organization, and what I've learned across the work and the partnerships I've had with my colleagues is there's this theme of servant leadership. We put our community first. And so this team that I lead exists. We exist as these internal subject matter experts on environmental stewardship to understand and take those emerging ideas and translate them for our business, the quality of care, and of course, positive environmental impact. And I forgot if there's a two-part, was there a two-part to that question, or?
No, I mean, that was kind of why you guys are doing what you were doing. So I'm going to come back to you on some of the specifics on what you guys are doing, but Representative, and you've addressed this a little bit already, but you know, as we've talked about today, climate change, like the COVID-19 pandemic and a whole host of other issues, is not impacting everyone the same. Can you talk a little bit more, expound a little bit more on what type of impact climate change is having specifically on brown and Black communities in Wisconsin?
Sure can. I can talk about this for hours, actually. However, some of the specific issues that climate justice or climate change is having on Black and brown communities, we could talk about our water quality in certain areas. We could talk about the impact of higher costs of energy as a result of polar vortexes. And we could talk about just quality of breathing air, et cetera. But I think that the doctors spoke about it most readily when they talked about, when Dr. Lewandowski said it's not just your asthma rates, it's not just your breathing, but it's on par with other health indicators. If you have diabetes in certain areas, if you have chronic lung disease in certain areas, that you're going to have more of a harder time as a result of climate change. I know that we don't have hurricanes necessarily, even though the Lieutenant Governor pointed out the hurricane in other parts of the Midwest, but we don't have them readily here, but they're becoming stronger. And they're going to be in places like in the Bahamas, where you have a lot of Black and brown folks. You have hurricanes that will hover over islands for 3 and 4 days at a time. And like the Lieutenant Governor stated, you have a lot of people who will be escaping flooding. They will be escaping climate change in other coastal areas and coming to places like the Midwest. We'll have more people, and we'll be spending more money on heating, on air conditioning, et cetera. Also, people may not know this, but over the past 5 years, you've had more deaths as a result of things like heat exhaustion in northern areas, where it's not just in the South or in the Florida or on the coast, on the West Coast, et cetera. Places like Philadelphia, places like Chicago, et cetera. One of their rising costs, deaths in the summertime was heat exhaustion of our elderly folks, because we're getting warmer in the summer times, and not just colder in the winter, but warmer in the summer times as well. And so in any time, there's an old phrase that says, if everybody else gets a cold, the Black and brown communities get the flu. So if you look at our health conditions, if you look at our rates of increasing of paying for energy, if you look at our rates of lead in our water, et cetera, you see those skyrocketing as climate justice affects us in different areas.
Thank you. Lieutenant Governor, you, in addition to chairing the governor's climate change task force, you chair the governor's equity task force. Can you as well just talk a little bit more about the intersection of these issues?
So I don't share the other one. I just want to clarify that. But there's so much intersectionality that hadn't been explored prior to. I mean, this is exactly an issue of equity. This is the definition of issues of equity. So I try to make sure that when we have those conversations about equity, that we are talking about climate change. And I even bring this to our Health Equity Council, One of my biggest recommendations was the creation of the Office of Environmental Justice to address these very specific issues. And, it could be easy to look at. It's like, that's, seems like a lot. But I think there are only 2 Great Lakes states that don't have this position, Indiana being one, and Ohio, maybe Ohio is the other. But this would just put us on par with our Midwest neighbors, with our Great Lakes neighbors, especially as we are blessed with the vast natural resources that we have. We have to be good stewards of it. We're surrounded by 3 bodies of fresh water, Lake Michigan to the east, Lake Superior to the north, and the Mississippi River to the west. So environmental justice has to be a part of all of our conversations. And we've talked about pollution. We've talked about, the disproportionate impacts that climate change is having, and also the contributing factors of climate change being the same contributors to poor health outcomes. But there are also some other issues of environmental justice. We talk about fossil fuels, and how fossil fuels are transported from one place to another, and how tribal treaty rights have oftentimes been just trampled upon. Our indigenous community, our native community here in Wisconsin, we have 11 federally recognized tribes, and we have to honor the treaties, but too often it's so easily disregarded. My very first speech on the assembly floor in 2013 was about the proposed iron ore mine because of its impact on air quality and water quality. I was proud to speak out about it, even though it was an issue, hundreds of miles away from the district that I represented. It was something that I could easily draw the parallels. This is happening, and this is happening in areas where we have a vulnerable community. Then it could easily happen in the area that I represented. And it was important enough for me to speak out against it. So with that being said, the issue of equity has to come up. When I took my oath of office, I said, we're going to leave the core principles of equity and sustainability, because we can't separate the two. The two have to be wedded. The two have to be discussed in tandem if we want better outcomes overall. So if I'm talking about equity, I'm bringing climate change to that conversation. If I'm talking about climate change, I'm bringing equity to the conversation. And that's the way we should be doing it.
So Lieutenant Governor, where are our efforts right now to create an Office of Environmental Justice in Wisconsin?
Yep, it is. So that was a recommendation in the governor's task force, the task force on climate change report, and it will likely be included in the report from the Governor's Health Equity Council. And there are a couple ways you can do it. It can be through legislation, which I would rather see happen, because I would rather more legislators, took the Supreme Moore-Makunde route of actually taking this issue seriously. But I don't know that majority exists yet. There is a potential for executive action, and I would hope that that executive action is strongly considered in the event of, because it's a position we absolutely need.
Thank you. Monica, let's go back to you. Can you talk more about some of the specific steps that Advocate Aurora is taking to address climate change? There's a lot of other hospital leaders tuning in today. I mean, where do you think that hospitals, health systems can make the most difference?
Yeah. So I'd like to just first highlight that when we talk about this climate crisis, sometimes I'm often asked to describe it using one word. And we like to use the word preventable. And so we are doing what we can, understanding our influence and how we design and construct, how we operate, how we purchase, invest. And as we think about new service patient offerings, we think about how we can have the best environmental impact. There are commitments that we've made, such that in 2019, we committed to 100% renewable electricity by 2030. So earlier I mentioned Sheboygan and Milwaukee and air pollution. Most people might not be aware that within the Midwest, a lot of air pollution is directly contributed to the burning of fossil fuels for our electricity. So by taking that step, we're moving our contributions to a cleaner source of electricity so that we're not contributing to poor air quality. not just in the communities we operate, but across the Midwest in general. We've made commitments to source and implement healthier, safer products. So when you come into our facilities, our primary focus is on human health outcomes. And we want to ensure that we are providing our clinicians, our physicians with the highest quality tools. And what we've learned over time is that sometimes these products are made with chemicals of concern. Once they leave our facilities and enter landfill, or they are recycled, they can contribute to some of these adverse health outcomes we're seeing in our patients. So we've taken this philosophy of first do no harm, and we are sourcing healthier, safer products. And an accomplishment we've made to date is of our interior furnishings across our facility, 95% of our spend is without some 5 key endocrine disrupting chemicals. I'm not going to get into the technicality of flame retardants, perfluorinated chemicals, PVC, formaldehyde, but I think you understand, the spirit of what we're trying to achieve and through the commitments that we're making. And a lot of people, are focused, around, we talked about water quality and waste and so forth. And, we're doing everything we can to increase our recycling and diversion efforts from landfill. Just that in 2020, we diverted 76% of all of our construction debris from landfill. So those are just a couple of examples of activities. But we start really with our facilities. Within our built environment, we have LEED certified buildings that are the highest level of environmental stewardship. Aurora Medical Center in Summit is a LEED facility. Aurora St. Luke's Medical Center is a LEED certified facility with a healing garden. Aurora Medical Center in Grafton. And then we're going to be opening 3 new facilities and major renovations that are all pursuing LEED and our homegrown, what we call our Healthy Spaces Roadmap, which is taking the best of these principles across the industry and integrating it into our design and construction. But, there's one in Mount Pleasant, which, as we know, Racine has achieved EPA non-attainment due to poor air quality, and we're doing what we can to contribute to those healthier, safer environments. Aurora Medical Center in Sheboygan, and Aurora Medical Center in Pleasant Prairie.
So these efforts are not all inexpensive. Is there a business case for all this, or is this just the right thing to do?
It's a mix of both. For us, it begins with our responsibility to our community members. It's the right thing to do. And by making these investments, we understand that there will be trade-offs. But we also understand that by making these investments, there will be savings. So people might, look at our RE100 commitment and make assumptions about it. But it's like what you do at home. If you invest in specific energy efficiency mechanicals, over time, you're going to see reduced consumption. Consequently, that's savings. And for us, that savings can be reinvested into our patient care. And the same thing is true for the choices that we're making about our environmental stewardship practices. So we're pragmatic in our approach, and we're looking for these shared outcomes, ensuring that we can support, once again, that quality of care and having that positive environmental impact.
What is holding Advocate Aurora back from doing even more? So you guys are already doing a lot, but is there more you could be done? And if so, what is preventing that from happening? I mean, what can policymakers do to help with that?
Yeah, no, I think I would say we're doing a lot. We are one of the 11th largest health system in the country, and we're leading on a lot of this work. For policymakers, when I think about legislators and policymakers, I'm telling Lieutenant Governor Barnes and the representative here, I think about them having a broader purview. And for us, it's useful for them to help us connect the dots within the districts and across the state. If we think about our role within healthcare, we're really focused on that value chain of our healthcare practices and doing what we can with cross-sector collaboration. Once again, we're appreciating this conversation to elevate what we've accomplished. I think that, with increased technology and innovation and a market for more renewable electricity, or as we start to think, about our support of the community solar bill and third-party financing, that would make it a very positive future for us to be able to attain this at a faster rate.
Thank you. Lieutenant Governor, you are hoping to represent Wisconsin in the U.S. Senate. What more can federal and state lawmakers do to address climate change?
Well, I'm here on state time. Just want to be real intentional there. But
broadly, what more can federal lawmakers?
Yeah, no, absolutely. Well, absolutely. Because I mean, the way I look at our task force report, this assumed no help from the federal government, which is why our goal was 2050 in the report of carbon neutral. So with that being said, 2050 is way too late. Everybody's goal is 2035 or sooner. But like I said, the report we put out, it was aspirational, it was bold, but it was realistic. And with no help from the federal government, we didn't know what the presidential election was going to look like. We didn't know what action or inaction would be taken by Congress. So given the resources that we have at our disposal, given the brain power and the natural landscape, 2050 was what was realistic. So with that being said, support from the federal government can help us bump that up 15 years to get us to 2035. These things aren't cheap. These things aren't easy. And these transitions are going to take time. And we will also need more resources to help those transitions, whether it's the people, who would be changing careers. And one thing, like I said, I always say that we're fortunate is, like, we're not an extraction state. There aren't a bunch of oil jobs. There aren't coal jobs here. It's just, this is not where it comes from. So there are fewer considerations than a state like, Kentucky or Ohio. But with that being said, in order for us to make the large scale investments that we need in a short amount of time, only the federal government can make that happen. And there, were lots of opportunities for us with the infrastructure bill in terms of public transportation, being able to, electrify bus fleets, for example, allowing us to be able to implement, more rail routes across the state, which would be incredibly helpful, right? Like, it's still just bizarre that Amtrak doesn't go through Madison, right? Like, it's just the wildest thing in the world. I mean, even other civil engineering mistakes, like the Amtrak station being a mile from the airport in Milwaukee. You go anywhere else, the rail just goes right to the airport. But whatever. I wasn't around then. A lot of us weren't, and had nothing to do with the implementation. But there are certainly opportunities, even with electric vehicle transportation infrastructure as well. So there are steps that are being taken, but in order for the federal government to be the most impactful, I think that whatever path is chosen, right? And I do think we need to take the boldest path to address climate change. The fact is, every state is unique. The solutions for Wisconsin are not going to be the same as the solutions for California or Florida. And we have to maintain that perspective. I mean, the solutions for Wisconsin won't even be the same as Iowa, where they're getting 60% of their energy from wind. I mean, just where they are situated, the entire state is better off, for wind. Now, it is evidence that we still have not come anywhere near close to reaching our capacity for wind in the state. There are still lots of opportunities for us, but it's going to take all of us working together. But it's also going to take an understanding and respect for the differences and the opportunities that each individual state will have to address the crisis.
Thank you. Representative, what more do you think that state policymakers can do? Where are your efforts focused right now?
There's so much more that we could do. And I'm glad you have us here today. And I'm glad that we have this intersection of government and folks in the healthcare industry, because it helps people to see that it's more real. And number one, people need to put pressure on elected officials like myself and Lieutenant Governor Barnes and other folks to let them know that this is something that they care about. Like he said, the date is 2030, not 2050. And also we need to talk about more legislation. I have a couple of pieces that are out right now. One is on bill financing. It allows a utility to take some of the costs that people are paying per month and put it towards upgrades to homes. And I have another bill that talks about a just transition to jobs, looking at some of our industries that need green transitions. We need to get away from coal burning fuel. We need to get more greenhouse gas or less greenhouse gas emissions in our environment. We need to shift some of our industries to some of those jobs, and we need to do some of those transitional jobs trainings. If I look at our city county task force on economic equity, it's very similar to what some of the things in the governor's task force was at the state of Wisconsin. We talked about greenhouse gas emissions and reducing our emissions and strategies on how we would reduce our emissions. We talked about jobs and equity in those jobs and what some of those jobs would be. Installing solar panels, making sure that we're retrofitting roofs, making sure that we're installing in homes, we're redoing the heating systems, not only to make it better for those living there, but also to reduce the costs that would be there as well. We talked about finance and funding opportunities. We talked about education and community outreach, meaning that we know we have those individuals in our communities who claim to know more about economic inequity and climate justice than anybody else. But how do we talk and have regular conversations in our communities? We talked about that, and we talked about monitoring and accountability and how we would be accountable and hold big corporations accountable, because we know it's one thing just to recycle your goods, making sure you're separating plastic from cans and getting them out and making sure they're getting picked up once a month. But we also have to hold these corporations accountable, these larger industries accountable, these larger utilities accountable as well, because that's where most of our greenhouse gas emissions are coming from. We need to make sure that they are reducing greenhouse gas emissions as well. And also we talked about electric buses. One of the things that we did in Milwaukee County was we're trying to transition our fleets to electric batteries. Now, it takes some time because those batteries don't always work in extreme conditions like extreme cold and extreme heat, which we have in Milwaukee County and in the state of Wisconsin. But we need to make sure that we're getting back on that pathway to having those greenhouse gas emissions reduced as a result of our efforts. So we need to call your elected officials, call people like me and your senators and your governor's office, ask them what their climate impact plan is, and say, what do you plan to do about climate justice? And it doesn't matter if you live in Milwaukee, if you live in Madison, if you live in Ashwaubenon, if you live in Winnebago County, it affects everyone the same. Everybody's gonna be impacted. Nobody's gonna be left. You need to call us and ask us what our plans are and make sure that you put our feet to the fire and make us prioritize these in our budgets. Because like you said, it's not inexpensive. It's work that we have to do. It's something that we have to prioritize our dollars to changing as well. So make sure we're going to be doing that.
Dr. Lewandowski, do you think that policymakers are doing enough to address climate change?
No. We've known about this since 1990. I mean, like, we've known about this before 1990. 1990 is when the IPCC was created. And, you know, I've seen lots and lots of planning, which is great. I mean, Governor Doyle, they created a climate change report as well. And what's going to help my patients is action. Planning is important, but action is what's required for things to change. And while I'm talking, I do just want to comment on a couple other things. As the only doctor on this call, I want to emphasize that there is no biological basis for climate change harms affecting communities of color. That it's the discriminatory housing practices, the redlining, it's the legacy of racism that's affecting those communities. We know that racism and race itself is a social construct that was created in the 1600s to morally justify slave trade. And it was cemented in the United States in the late 1600s around the time of Bacon's Rebellion. And so we can track the disproportionate effects on humans because we can say, hey, look, here are these redline communities. Here is their location to hazardous materials. Here's their location to PM 2.5 and air pollution. Here is how redline communities are more likely to be affected by extreme heat. And then kind of transitioning to healthcare savings. One of the questions you asked as well was if healthcare systems are saving, Gunderson, which I know it sounds like, Tim, once upon a time you were hoping we could have someone from them. Gunderson is 100% renewable, essentially. They created the Envision program in 2008. And, since 2008, as of 2021, Gunderson healthcare system, they surpassed over $24 million in savings as a result of their creative waste diversion practices. We know that UW Health, over a period of several years, they were able to actually expand the size of their facilities at a time that there was increasing cost of energy, and their overall costs for energy provision actually decreased despite the increasing footprint and the increasing size and the increasing cost. And so, this is definitely economically feasible and important. It's just something that needs to be prioritized by leadership and needs to be budgeted for. We know that the costs of, the healthcare savings themselves, there was the Center on Wisconsin Strategies in 2019 published a study showing that if we were to reduce air pollution as a result of 100% clean energy, in-state production, 100% clean energy, that Wisconsin would save $21 billion every year in avoided health damages. That's just the health damages. That doesn't even talk about the $14.4 billion that we spend purchasing out-of-state fossil fuels, like natural gas or coal. So there is such an economic argument to this that we can't overlook that.
So what, Dr. Lewandowski, what do you think is holding back more from happening, holding back policymakers from doing more, holding back other health systems from doing more?
Let me tell you, I wish I knew that answer. I don't know that answer. I just know that every governing health body that has any merit to their name has declared climate change an emergency. They have said that it is affecting our health now and that multidisciplinary action needs to happen yesterday. And we know that there is a real deadline. Climate change is here. The 2030 and 2050 targets, those are all about preventing irreparable climate change harms. We're still talking about like trying to prevent things from happening, but eventually this will no longer just be human caused, but there are climate cascades, climate thresholds, and tipping points that will, then be sort of outside of our control. And then the only thing that humans will be capable of doing is adapting to climate change. There will be no more prevention. And so I sincerely hope that we can find that answer as to why there isn't more widespread action within the United States and abroad.
So we are quickly running out of time, but I do want to save the last 5 minutes we have to ask each panelist, one final question I'm hoping each of you can answer. And we're now down to about 4 minutes, so I'll give you each about a minute to answer this question. But if you had to pick one thing, we've talked about a lot today. There's a lot we didn't get to, but if you had to pick one thing, what do you think is the most significant step that can be taken now to impact climate change? It can be big or small. It can be a step that a policymaker can take, or a health system, or an individual. But Monica, we'll start with you. If you had to pick one, what would it be?
Oh, this is tough. I can't pick one. Can I just quickly rattle off a couple? There's so many.
A couple big ones.
There are so many opportunities to feature a shared goal: reduce carbon emissions. Short term, across the globe, we saw air pollution improve with reduced transportation. We saw firsthand the impact reduced single occupancy vehicles had on air quality. And transportation accounts for 30% of Milwaukee's carbon emissions. So implementing electric vehicles would have a similar effect with greater renewable energy mix. There's reduced energy consumption, transitioning to renewable energy, removing recyclable products and organic waste from your waste stream, focus on supply chain, on healthier, safer products, recyclability, addressing chemicals of concern. And I'd like to highlight, those purchases and of course, investments, because aligning purchases and investments to those broader environmental goals is an example I like to give. Aligning purchases and investments for me is turning off the tap water. Without those changes, all other activities equate to me cleaning up the spilled bathwater.
Thank you, Monica. All good ideas. It was more than one, but all excellent. Excellent thing. Lieutenant Governor, what about you? What is the most significant step that can be taken now to impact climate change?
So one of the most significant steps, I guess the first one that comes to mind for me is probably fixing our broken food system. I brought that up earlier, but the fact is a broken food system contributes to increased carbon emissions and corporate irresponsibility. As Representative Moore-Mukunde stated, 100% of us, all of us, can recycle every day and put solar panels on our homes and do everything we need to do. But at the same time, 100% of corporations in this country, or 100% of corporations will still account for 70% of carbon emissions. And a lot of that is in the food industry. We have a significant problem with food waste. We have a significant problem with biodiversity in our crops that is depleting our soil health, as I mentioned earlier. And so I would say doing this the responsible way, regenerative agriculture, more responsible, sustainable farming, would help us to actually combat climate change. And it would help us to take more carbon out of the air. But the process that we've been going about and the federal incentives now only promote bad behavior. And that's something we got to change.
Excellent. Representative, what is one of, that's a better way to phrase it, what is one of the most significant steps that can be taken now to address climate change?
I think we got to put pressure on elected officials and government officials to prioritize the monies that is needed to transform our society. We have to make sure we need to have bold and dynamic legislation that talks about combating climate change. We need to put our money where our mouth is. At the very minimum, we need to put our money where our mouth is, and we know that this is important, so we need to spend our money on it as well. So out of the many things, I think that is kind of the linchpin of them all.
Great. Dr. Lewandowski, we'll give you the final word.
Sure. So I think the most significant action is really any equitable action at this point, big or small. You can work together with a team, a green team at your hospital. You can, go it alone. You can reach out to Wisconsin health professionals for climate action. You can work with your neighbors, your family, really any commitment, big or small. Talk about the webinar today with your friends and family. Talking about it in and of itself is action. Making sure that this is not something that's overblown as being super taboo. Like, this is happening and it needs to be changed. And, I really want to encourage people who are watching the webinar today that I don't want the enemy of good to be better. We don't have to wait until every last little detail is figured out. If the principles for climate justice solutions are kind of held close at hand. And, the phrase that comes to mind a lot for me is that the journey of 1,000 miles begins with a single step. And we have a lot of ground to make up for our children, our patients, and our communities.
Thank you. Well, thank you guys for really a great and wide-ranging discussion. Thank you to Hush Blackwell and all our sponsors for making today's discussion possible. You can find full coverage of today's event in our newsletter, Wisconsin Health News. We will also be continuing the discussion tomorrow with our sister publication, Health News Illinois, featuring Monica and some other Illinois panelists for an Illinois bent to this conversation. You can log on to that for free at healthnewsillinois.com with you can find a registration link there as well. Again, thank you guys for a great discussion and hope all have a great rest of the day.
Thank you.
Thank you.